Obesity is a complex chronic disease of excessive or abnormally accumulated body fat. As a medical condition, obesity can lead to a range of health complications, including high blood pressure, diabetes mellitus, heart disease, osteoarthritis, obstructive sleep apnea, liver disease, and even certain cancers. Managing obesity can be challenging. That's why the endocrinology experts at the American Association of Clinical Endocrinology have created the Journey for Patients with Obesity. This journey is your roadmap for up-to-date information and resources to navigate your diagnosis, treatment plan, and wellness goals, no matter where you are in your personal journey. There are 5 steps to the Journey for Patients with Obesity, and each covers a different part of your experience living with obesity. You'll take your first step on your road to better health in the Contemplation section. Here, you'll learn about the common causes of obesity and the life circumstances that can contribute to it. You'll also find tips on how to have effective conversations with your healthcare professional about managing obesity. The initial assessment section explores the various types of information your healthcare professional gathers to understand your health status, risk factors, and specific needs. This information helps them develop personalized treatment plans, set realistic goals, and provide appropriate interventions. In the diagnosis and staging section, you'll learn how your healthcare professional diagnoses your stage of obesity. This information guides them in determining which treatment options might be right for you. In the treatment and goals section, you'll discover recommended treatment options, including lifestyle changes, medications, and surgery based on your stage of obesity. Obesity is classified into 3 stages. Stage 1 is obesity with no related complications. Stage 2 is obesity with 1 or more mild to moderate complications. Treatment options may include medications. Stage 3 is obesity with 1 or more severe complications. Treatment options may include medications and/or surgery. Together, you and your healthcare professional can create a personalized treatment plan. The Care and Continuity section explores how to set manageable goals, find patient support groups, and reduce your risk of obesity-related complications to improve your overall health and well-being. You're not alone on your journey with obesity. AACE is by your side as you take steps toward better health. Get started on your journey for patients with obesity today. Visit aace.com/obesityjourney. Support provided in part by Lilly and Behringer Ingelheim.